Wrist and hand anatomy. The bones of the hand and the wrist provide the body with support and flexibility to manipulate objects in many different ways. Each hand contains 27 distinct bones that give the hand an incredible range and precision in motion. The forearms, ulna, and radius support the many muscles that manipulate the bones of the hand and wrist. Rotation of the radius around the ulna results in the supination and pronation of the hand. These bones also form the articulation of the flexible wrist joint with the proximal row of the carpals. There are 8 small carpal bones in the wrist that are firmly bound in 2 rows of 4 bones each. The mass that results from these bones is called the carpus. The carpus is rounded on its proximal end where it articulates with the ulna and the radius at the wrist. The carpus is slightly concave on the palmar side, forming a canal known as the carpal tunnel through which tendons, ligaments, and nerves extend to the palm. Its distal surface articulates with the metacarpal bones, which are joined to the carpus by the palmar carpometacarpal ligaments. The 5 long, thin metacarpal bones of the palm extend from the carpus of each of the digits of the hand. Each metacarpal is numbered 1 through 5, with metacarpal 1 connecting to the bones of the thumb. Metacarpal 5 then would connect to the bones of the pinky finger. Movement of the metacarpals by tiny muscles in the hand allows the palm to be stretched, compressed, and folded as needed. The distal head of the metacarpals are rounded to form a condyloidal joint with the phalanges of the fingers. These condyloidal joints allow for 360 degrees of motion of the fingers at their bases. Each of the digits of the hand contains 3 phalanges. The singular for phalanges is phalanx, except for the thumb that only contains 2. The phalanges are long, slender bones that form hinge joints between each other. The phalanges that articulate with the metacarpals at the base of the digits are known as the proximal phalanges. The phalanges at the end of each digit are called the distal phalanges. In all of the digits except for the thumb, the middle phalanges are found between the proximal and distal phalanges. Muscles in the forearm flex and extend the phalanges by pulling on long tendons that run through the wrist and hand. Knuckle cracking does not serve any beneficial purpose and may be harmful to the fingers due to stretching of the joint capsule. The hand itself has 19 bones, 5 elongated metacarpal bones, which are next to the wrist and make up the palm, 14 phalanges, which make up the fingers. Each finger then has 3 phalanges and the thumb has 2. These 19 bones collectively form 14 separate joints. The joints are formed wherever 2 or more of these bones meet. Each thumb has 2 joints. It has a metacarpal phalangeal joint or an MCP joint, which is the joint at the base of the finger, and an interphalangeal joint or IP joint, the joint in the middle of the 2 phalanges. Each of the fingers has 3 joints. A metacarpal phalangeal joint or MCP joint is the joint at the base of the finger. A proximal interphalangeal joint or PIP is the joint in the middle of the finger. The distal interphalangeal joint, or DIP, is the joint closest to the fingertip. The surfaces of the bones where they meet to form joints are covered with a layer of cartilage. This allows them to glide smoothly against each other as they move. The joints are enclosed by a fibrous capsule that is lined with a thin membrane called the synovium. This helps secrete fluid to help lubricate the joints. The carpus is formed from 8 small bones collectively referred to as the carpal bones. The carpal bones are bound in 2 groups of 4 bones. The scaphoid lunate, triquetrum, and pisiform on the proximal row, and the trapezium, trapezoid, capitate, and hamate on the distal row of the carpal bones. Mnemonics for the carpal bones are numerous and useful for memorizing the order and location of the carpal bones. They usually describe the position of the carpal bones from lateral to medial or thumb side to pinky side in the proximal row and then the distal row. 2 mnemonics are "She looks too pretty to try to catch her," SLTP-TTCH, or "Some lovers try positions that they cannot handle." These 2 mnemonics correlate to the carpal bones, running from lateral to medial or thumb side to pinky side, proximal row to distal. The distal radial ulnar joint is a pivot joint located between the bones of the forearm, the radius and the ulna. It is formed by the head of the ulna and the ulnar notch of the radius. This joint is separated from the radial carpal joint by an articular disc lying between the radius and the styloid process of the ulna. Together with the proximal radial ulnar joint, the distal radial ulnar joint permits pronation and supination. The midcarpal joint is the S-shaped joint space separating the proximal and distal rows of carpal bones. The intercarpal joints are between each bones in the row, are strengthened by additional ligaments. The radiocarpal joint or wrist joint is an ellipsoid joint formed by the radius and the articular discs proximally and the proximal row of the carpal bones distally. The carpal bones on the ulnar side only make intermittent contact with the proximal side. The triquetrum only makes contact during ulnar abduction. The radiocarpal, intercarpal, midcarpal, carpal metacarpal, and intrametacarpal joints are often intercommunicated through a common synovial cavity. The triangular fibrocartilage complex, or TFCC, is formed by the triangular fibrocartilage disc, or TFC, the radial ulnar ligament, and the ulnar carpal ligaments. The triangular fibrocartilage complex consists of an articular disc that lies on the pole of the distal ulna. It has a triangular shape and its periphery is thicker than its center. The central portion of the TFCC is thin and consists of chondroidal fibrocartilage. This type of tissue is often seen in structures that can bear compressive loads. The central area is often so thin that it is translucent, and in some cases it is even absent. The peripheral portion of the TFC is well vascularized, while the central portion has no blood supply. The disc is attached by a thick tissue to the base of the ulnar styloid and by a thinner tissue at the edge of the radius just proximal to the radiocarpal articular surface. The radial ulnar ligaments are proximal stabilizers of the distal radial ulnar joint. There are two radial ulnar ligaments, the palmar and the dorsal. These ligaments arise from the distal radius's medial border and insert on the ulna at two separate and distinct sites, the ulnar styloid and the fovea, or a groove that separates the ulnar styloid from the ulnar head. Each ligament consists of a superficial component and a deep component. The superficial component inserts directly into the ulnar styloid. The deep component inserts more laterally and into the fovea adjacent to the articular structure of the pole of the distal ulna. The ligaments are composed of longitudinally oriented laminar collagen to resist tensile loads and have a rich vascular supply to allow healing. The ulnar carpal ligament consists of the ulnar-lunate and the ulnar triquetral ligaments. They originate from the ulnar styloid process and insert into the carpal bones of the wrist. The ulnar lunate ligament inserts into the lunate bone, and the ulnar triquetral ligament inserts into the triquetrum. These ligaments prevent dorsal migration of the distal ulna. They are more taut in supination, because in supination the ulnar styloid moves away from the carpal bones volarly. The primary function of the TFCC is to cover the ulnar head by extending the articular surface of the distal radius, load transmission across the ulnar carpal joint, and partial load absorbing. It also allows for forearm rotation by giving a strong but flexible connection to the distal radius and ulna. It also continues to support the ulnar portion of the carpus. There are many ligaments within the dorsal and palmar surfaces of the hand. Hand injuries are common. It is obvious from these pictures that injuries can be difficult to diagnose as there are many structures in a very small space. Hand injuries should be taken seriously and referred to a hand specialist immediately. Losing dexterity, movement, and function at the wrist, hand, fingers, or thumb can be extremely debilitating. The wrist and each metacarpal phalangeal joint, proximal interphalangeal joint, or distal interphalangeal joint in the wrist, hand, and fingers have both an ulnar collateral and a radial collateral ligament. When the body is standing in the anatomical position, the arms are by the side and the palms face forward. The ulnar collateral ligament is on the medial side or pinky side, and the medial collateral ligament is on the lateral side or thumb side. You need to make sure that you specify the joint that you are referring to when you describe ulnar collateral and medial collateral ligaments. Just like the picture of the ligaments, there are a lot of muscles, tendons, and retinacula that occur in the hands. It is easy to injure these structures, but it can be difficult to determine what structures have been injured. The extrinsic hand muscles are located in the forearm where their bellies form the proximal fleshy roundness. When contracted, most of the tendons in these muscles are prevented from standing up like a taut bowstring around the wrist by passing under the flexor retinaculum on the palm side and the extensor retinaculum on the dorsal side. On the palmar side, the carpal bones form a carpal tunnel through which some of the flexor tendons pass in tendon sheaths that enable them to slide back and forth through the narrow passages. Starting from the mid position of the hand, the movements permitted in the wrist are marginal movements including radial deviation or abduction or movement towards the thumb, and ulnar deviation or adduction and movement towards the little finger. Movements in the plane of the hand include flexion or palmar flexion tilting towards the palm, and extension or dorsiflexion tilting back towards the back of the hand. Each finger may flex and extend, abduct and adduct, and also circumduct. Flexion is by far the strongest movement. In humans, there are two large muscles that produce flexion in each finger, and additional muscles that augment that movement. Each finger may move independently of others, although the muscle bulks that move each finger may be partly blended and the tendons may be attached to each other by a network of fibrous tissue, preventing completely free motion. Fingers do not contain muscles other than the erector pili. The muscles that move the finger joints are in the palm and the forearm. The long tendons that deliver motion from the forearm muscles may be observed to move under the skin and wrist and on the back of the hand.